For reaction to today's numbers and the modeling data released by the provincial government, I'm joined now by Dr. Ann Huang. Dr. Huang is a former Deputy Medical Health Officer in Saskatoon. Thanks so much for being here.
Thanks for having me, Sam.
What stands out to you from the information the province released today?
I think it's great that they provide detailed epidemiological and modeling data for the public today. I think what stood out for me was that at the end of the presentation, it's not clear to me that if we have perfect adherence to the new public health measures that have been announced, i.e. everyone wear a mask in indoor public spaces, we limit our gathering size, and whether that's going to be truly enough to bend the curve that's now growing with an effective reproduction number of 3.3 province-wide. And how long it's going to take for us to bend that curve or flatten the curve if we were to adhere the measure. And so it stood out to me that we were not given an expected outcome of these public health measures, which I would think the modeling could actually forecast.
Now that's something that is concerning, but what concerns you the most out of all of that data?
Right. So when this presentation, when the slide showed the effective reproduction number of the different geographic areas in Saskatchewan, what really stood out is that, number one, the overall effective reproduction number is 3.3 now throughout the province. That means every new case is infecting between 3 and 4 people on average. But in integrated north, which includes the northern zone, so places like Prince Albert, North Battleford, as well as the far north region, we have an effective reproductive number now that's over 4. It's 4.2 as of November 14. We've never seen numbers this high. This is rapid exponential growth. And so that is really concerning.
For those of us continuously looking for a silver lining, I would be one of those people. What would you say?
And it was really encouraging that Dr. Shahab, the chief MHO, talked about the projected timeline for COVID vaccines to be available in the province. And that relates to the recent announcement of Pfizer as well as Moderna's messenger RNA vaccine having more than 90% efficacy during its final phase of clinical trial. So I think it's important to remember that as hard as it seems right now with all the public health restrictions to combat COVID-19, there's an end in sight. And we're looking at another 6 months of doing what we can to limit the collateral damage from the virus and from the disease. But hang in there. There's an end in sight, and we'll get to it together.
Thanks so much for this, Dr. Huang.
You're welcome. Thanks.
Dr. Ann Huang is a former Deputy Medical Health Officer in Saskatchewan. She joins us from Saskatoon tonight.